everyone. I'm Lisa Vanderpool, and welcome to our latest Meet the Press virtual panel. We're so excited to be here today. Today's topic is digital transformation in healthcare, the impact of COVID-19, and predictions for 2021. Thank you to all of our panelists for being here. This is going to be a really interesting and important discussion. And moderating the panel today is our Rachel Durant. She's a manager here at InkHouse. She's a force on healthcare practice, and she's also important to many other practice areas, including education. And one more thing you should know about Rachel is that she's passionate about the media and storytelling. And so Rachel, I'm just gonna let you take it away.
Thanks, Lisa. And welcome to everybody, and especially welcome to our panelists. I'm going to introduce each of them, and then we'll kick off our discussion. So joining us today are Anjali Khemlani, a senior reporter for Yahoo Finance, Alexi Cohan, a reporter for the Boston Herald, Jessica Kim Cohen, technology reporter for Modern Healthcare, and Megan Thielking, news editor for STAT. Before we jump into this conversation with our amazing panelists, I just wanted to let everybody know that if you have any questions that you'd like our panelists to answer, you can direct those to Lisa in the chat feature in Zoom. So please, submit those and we'll get to as many as we can today. So first, I'd love to kick it off with just a quick rundown of what you cover and what your role entails. So Anjali, can you please get us started?
Sure, yeah. So a little bit about me. As you know, I'm a senior reporter for Yahoo Finance, been covering this pandemic since the beginning. One of my colleagues told me, I think it was sometime mid to end January, it's your Super Bowl. And I gotta tell you, it's the longest Super Bowl ever. I don't think Super Bowl reporters have to cover for this long. It's been an interesting journey. And as I've been pretty public about this, but having experienced the virus myself, it has definitely added to the depth with which I can cover this, but it also makes me sort of more aware and more confident about what's going on and the news that's coming in. So definitely an interesting time to be a healthcare reporter, and looking forward to continuing the year, I say in a semi-exhausted voice.
Absolutely. Alexi, would you like to go next?
Sure. Thanks so much for having me, Rachel. So happy to be on the panel. I think I have to agree with Anjali that it feels like a Super Bowl. I have also been covering the pandemic since the beginning, since January, since before it was here and before some people didn't even know it existed. It's really taken over my health and medicine beat here at the Herald. I've been with the Herald for 2 years. I've been covering health for that entire length of time, and I've also been covering education for the last year or so. I've never seen health and education combined so tightly ever before. They're really interlaced and interlocked these days, which is great, but it's also very tiring. As we know, the news cycle is just changing on a dime, and it's making things a lot of fun. It's making things exciting. It's making things tiring. But yes, I'm pretty much covering all things COVID-19 and pandemic related while also tying in some education.
That's great, and definitely a busy news cycle for both of those industries. Jessica, would you like to go next?
Hi, I'm Jessica. I am a reporter for Modern Healthcare, which is a business magazine for the healthcare industry, including healthcare providers like hospitals and health systems, and also health insurers. And over at Modern Healthcare, I cover our technology beat. So that's everything from kind of the standard information systems that are in place at most organizations, like electronic health records, but also some emerging technologies like artificial intelligence and wearables devices. And of course, right now during COVID, it's a lot of discussion about telehealth and virtual healthcare and how that's been affecting the industry.
Definitely a topic we want to get into today. Digital health, telehealth, health tech, huge right now, and will continue, I think, to be in the months and years to come. And Megan, would you like to go next?
Sure, thank you so much. My name is Megan Thielking, and I am a news editor at STAT, which is an online health and medicine publication. I started this pandemic as a reporter, actually, and was covering it just like everybody else was, with a little bit of everything, but moved into an editing role 1 week after STAT went to be fully remote. So now I'm our health tech editor. So I edit our coverage of digital health and telemedicine and AI in medicine. We have a weekly newsletter, sort of a deep dive newsletter about that I edit. And then, like everybody at STAT, I edit a little bit of other stuff too. So I edit some of our COVID coverage and some of our pharma coverage. So but health tech is sort of my bread and butter in editing.
Sounds like just a couple of things that you're working on, Megan. I'm sure that, with everything being so busy, you're not super swamped with coverage in all of those areas where they're very involved in the pandemic. So obviously, leading off, I think we all know COVID-19 has impacted the healthcare industry from top to bottom and clearly has had a really robust impact on the news. So it'd be great to hear each of you talk a little bit about how COVID-19 and the busy news climate has really impacted your publication and role. I know we've gotten into it a little bit already, but would be great to hear a little bit more. So Megan, I think as an editor, it would be great if you could lead off this part of the discussion.
Yeah, so it's interesting because, in a given non-pandemic time, STAT covers a pretty wide mix of things to start with. So like I said, we cover telemedicine and AI in medicine, but we also have a pretty strong biotech and pharma team. We have a number of people covering public health. We have a couple of people covering more of the science side of things. So it's interesting just how COVID has really shifted the dynamic of what we have the bandwidth to cover. Just so many things are touched by COVID now, including a lot of those beats. So, I mean, obviously it's a public health story, but also, there was a lot of, especially in the earliest stages, really basic science work that we had to cover. Obviously, it's a huge biotech and pharma storyline. I mean, we have a DC bureau that's covering Operation Warp Speed and the election and COVID and all of this stuff. So it's interesting because it has really forced us to rethink our priorities in terms of what we can capably cover outside of COVID, just being a relatively small team of people. So it's certainly upended just the normal things that we cover, I would say, and who is able to cover them. But it's honestly, like I said, and I think this is true even with Alexian education, like it really has touched on everything now, so that it's even within a confined set of beats within health and medicine, like it's touching on everyone's beats right now. I don't think there's anyone being spared COVID coverage right now.
Definitely. And Anjali, I know that you're definitely experiencing the same at Yahoo Finance, particularly with the economic uncertainty that's kind of in and around the pandemic. So can you talk a little bit about what that's changed for you besides it being your Super Bowl and the types of things that Yahoo Finance is covering?
Yeah, absolutely. I think that any pitch that doesn't have anything to do with COVID is sort of, I don't want to say second tier, but almost at that level right now. I think that everything is still very COVID focused, and rightfully so, because as is evident from everyone's reporting, we haven't really hit like a flow or any sort of normalcy when it comes to dealing with this pandemic. As much as has been learned and as much information that is available out there about the virus now, including treatment protocols, the way that, hospitals have figured out how to run, and the warnings about getting your flu shot so there's no double whammy. All of that information combined still hasn't resulted in any sort of stability. And so as a result, everything continues to be affected. Corporations are still weighing when to reopen offices, how to. Some people are already back in the office, but in limited capacity. What does testing look like, at these facilities? Is it a daily thing? Is it weekly? And then just how that all affects the market. The constant uncertainty is clearly evident in the movements the market is making. So I think that all of that combined is sort of where, the coverage has been focused. And to Megan's point, about like the scope of a team, just everything being so focused and the resources, not really preventing, but sort of limiting what anyone else can pursue, it's definitely absolutely the same. I think across the board, there just isn't really even any appetite because there's so many people still affected by this, and it's still affecting the country. So it just doesn't make sense to do it. But I have noticed, and I want to just say this, when it comes to, say, deals in the pharma sector or things that are normal in the pipeline of things, that's definitely being ignored, but it's still going. So for example, the FDA continues to approve other things or look at other disease states while still focused on COVID. So I find that interesting, and I feel like we're missing something as a result.
Definitely. And Jessica, I'm sure that you can agree with that. Being a healthcare focused publication, obviously the biggest healthcare story on a layperson's mind is COVID, but the industry is facing a lot of changes, a lot of things going on, both at the regulatory level and, as a direct result of this pandemic. So what have you seen at your publication, and how has this impacted the coverage that you're able to,
Definitely. I agree with a lot of what's been said so far, and don't want to take up too much time repeating it, but given that Modern Healthcare's audience, a lot of our readers are hospital executives, it's been interesting to see that so much of what they're interested in now is hearing from their peers, other hospitals who might be in a place that had surging COVID-19 cases, and they want to hear those best practices, both in terms of clinical care, but also in terms of a lot of hospitals had to shut their doors for non-emergency care at the start of the pandemic. So their finances might not be in a great place. So also figuring out how to weather this storm from a financial perspective. So figuring out how to find those best practices, and also the best way to share those with our audience, and kind of experimenting with some tips might be best for kind of a standard feature article. Some might be better served to do kind of a bunch of shorter articles, or to do a listicle. Or one thing Modern Healthcare launched that we didn't have before is a kind of running COVID-19 blog, where we do short updates on the same blog site of our website. So just trying out different ways to see kind of the best way to share specific information with our audience.
I think one of the important things you touched on is definitely with, hospitals and a lot of healthcare things, there's still updates going on and trying to kind of navigate those. So Alexi, covering Boston, which, not to be too much of a homer here, is really kind of a big center for healthcare and healthcare advancement in the country. What have you seen, and how has this impacted your coverage and your role, particularly on the healthcare side? But if you want to bring in some of the education stuff, I know that's also,
Yes, definitely. I always say that being a health reporter in Boston is such a huge privilege, because we just have access to some of the best resources, the best research, the best doctors. I mean, sometimes I'm really just blown away by the people that I'm privileged to interview. I'm sure everyone else has this experience. You're just talking to someone, you're like, wow, like there's just so much and so much knowledge that you can share and that you can pass along to your readers. So that has been great. Just throughout the height of the pandemic, and even now, being in touch with the big Boston hospitals on what they're experiencing, speaking to some of those ground level nurses who were confronting the battle head on, was just incredible to report on. Very scary, very impactful. Definitely some reporting that I'm never going to forget. And I think that all in all, that has changed the publication and the role, particularly because public interest has changed so much. I mean, if we think back to this time last year, nobody knew what social distancing was. Nobody knew or could even pronounce hydroxychloroquine. Nobody knew what remdesivir was. And now you hear these terms in average everyday society. So people are so hungry for the information. Early on in the pandemic, I did an open Q&A where people could email me any of their questions, and I sought to answer them by asking experts in the community. Got a lot of response from that. Some people, as I'm sure the other health reporters can attest to, try to ask you for medical advice, which you cannot provide. And that was a really great exercise. And we've just seen that public interest in our stories about COVID, especially on a very local level, have just skyrocketed. I mean, as we know, every Wednesday, the Massachusetts Towns Reports comes out, and that is like #1 on our website every Thursday morning. Even though it's a report that comes out every single week, people are expecting it. It's not like crazy enterprise exclusive, but people love it because they're so hungry for the information. And I also think that translates into a lot of a rewarding and gratifying feeling for my beat right now. I think people are relying on the information more than ever, and we have an additional responsibility to provide it to them in a very thorough, easy to understand, and accurate way.
Getting back to the medical advice question, as someone who watched all 800 seasons of Grey's Anatomy that they've had so far, I like to pretend that I'm a doctor, but definitely agree that you can't give out medical advice, but it's good to have access to those experts. And one of the things I think that has been most interesting about COVID-19 is really speeding up the digital transformation in healthcare. So, as Jessica's mentioned, there's higher utilization of telemedicine, and we're seeing kind of some changes there. So I guess I'm asking you to look into your crystal ball and see if companies and consumers are going to continue to adapt and adopt digital healthcare post-pandemic, and what factors do we think are helping and hurting? So Jessica, actually, do you mind kicking us off with that?
Definitely. I think right now, a lot of what hospitals at least are kind of waiting on is seeing how Congress and the federal government respond to this. Traditionally, one of the reasons that it can be hard to provide telehealth as a hospital is that there's a lot of regulations in terms of whether, whether a physician can see a patient for the first time via telehealth, or if they need to establish an in-person relationship first. There are regulations on where the patient can be based, if they can be at home or if they need to be at another healthcare facility at the time. There's also state licensing restrictions. A physician who's licensed in Illinois can't necessarily do a telehealth visit with someone who's based the next state over. So during the pandemic, a lot of these regulations were waived to make it easier for patients to be able to continue getting healthcare, even if it was done virtually. And right now, I think hospitals are waiting to see whether those waivers will stay in place or whether the regulations will come back. It can sometimes be a long process to have these changing regulations. So especially with some of the hospitals that might have lost revenue during the pandemic, might be operating on thin margins, it's hard to invest in a long-term telehealth program when they really don't know whether or not it's going to be feasible for them to continue offering telehealth in the way they are now. So some of it's going to depend on kind of those regulations, seeing how much patient interest is sustained after the pandemic starts to subside. So it's a few things up in the air that need to be considered when figuring out what telehealth is going to look like 1, 2, 3 years down the line from now.
Right. And Megan, I'm sure also at STAT, I know I've read a lot of coverage about kind of the adoption of these technologies and what that looks like. So what are you seeing, with the factors that might help or hinder it? Obviously regulations, but is there anything else that companies in this space should keep in mind when they're thinking about how to, integrate a digital?
Yeah, I think for us, another big focus area, in addition to telehealth and adoption and regulation, there is the same questions around remote patient monitoring. We had a big report come out in September around that question and dug into a little bit more about what it would look like to get broader adoption of those technologies as well. I think one storyline that we've been following, both in terms of remote patient monitoring and also telehealth, is the hurdles around access. We've written a fair amount about internet access, which is obviously a huge problem that has continued to come up and has not stopped being a problem despite everyone using telemedicine more. We've also written a little bit about telemedicine unreadiness and what it looks like to ask older adults or people who aren't comfortable with technology to adopt, people who might have hearing challenges. Like, there are a lot of access hurdles that still exist. And while we've done some coverage on that, I don't think it's something that I've seen a lot of companies talking about from that perspective. It's more, when we've written about it, it's more because there's been new research highlighting again how those things are a problem.
Absolutely. And, in terms of new research and where we're heading, I know Anjali's been really closely following the vaccine race, and I think that, has continued to be something that we're seeing. But Anjali, would be great if you could talk about the challenges and opportunities that you're seeing as we head into the fall and the winter in terms of COVID-19 and, where those storylines are taking us right.
Yeah, I think, to the point of the telehealth, that plays a role because I think when you're looking at what the opportunities are, it really is about a changing conversation in healthcare. I think largely looking at the sector, you can see that things that were sort of accelerated, had been conversations, but have been accelerated as a result of the pandemic, are really taking hold. And there are more serious conversations about how do we make this permanent? When you're looking at telehealth or looking at just prescription delivery as well, how to fold that into health plans and make that a covered service more broadly rather than just one-off, and trying to see if the laws and regulations, to Jessica's point, are in fact able to help encourage this move forward, because it's clear that there is consumer need and desire for a lot of this stuff. Now, when you're talking about, say, the vaccine pipeline, treatment pipeline, that's something that unfortunately is taking sort of a normal course. It is accelerated, by a huge number, but it is also following a sort of regular trend when it comes to what are the safety stopping points, as we've seen, to the point of, the vaccine trial halts, the Eli Lilly halt. So a lot of that is really coming into play. And I think it's interesting because we're seeing such a bright light on the sector in a way that has never been needed before. And the public is experiencing this scientific process as it happens. And so that's setting up really a lot more understanding, I think, for coverage to even be more broadly healthcare and more in depth than I think has ever been done before.
Right. And, I think that more broad kind of look at healthcare, and I think broader understanding by the public of what goes into an FDA, approval, even if it's an EUA approval or an EUA authorization, what does that look like? What does that mean? It's important to kind of have a pulse on that. And I think one of the things that this time of year we're always thinking about in a, quote unquote normal year, and this year is no different, are the trends that we're seeing that will carry us into next year. It's hard to believe we're already at the end of 2020. So when we're looking into 2021, Alexi, if you can kick us off, what healthcare trends are you seeing in the industry, and where do you see us going, in the next calendar year?
Oh man, that's such a big question. I mean, I do think that the next calendar year is going to be quite a roller coaster, as it was this year. And I think it's going to entail a lot of the things that we already touched on, one being digital access and telemedicine. I mean, we saw, this kind of harkening back to your previous question, but we saw that kind of steadily climbing before the pandemic, and now it has really just skyrocketed. So I think that's definitely a trend that we're going to see. I think we're going to see folks continuing to use telemedicine. As Jessica had said, we're going to see what restrictions are waived and what are not waived. And so I also think other digital and tech trends, like wearables to monitor your health. I think folks are a lot more aware of their health now. They want to make sure that they're okay. They want to track their sleep and their heart rate. And if they have symptoms, they have apps you can track with that. So I think the digital space is just going to continue to increase. And then I think we're going to see, definitely trends in public opinion around treatments and vaccines as they continue to emerge. I mean, we're going to have the election. Is the COVID vaccine going to be distributed, among a Trump administration or a Biden administration? And how is that going to impact whether people get it or not? How educated are people going to be? Are we going to see good trends among public health campaigns that people trust, believe in, and really glom onto? I think right now, there's two sides of the coin with the vaccine. A lot of people see it as the light at the end of the tunnel. They think they're going to go to their doctor and get it and go take a trip to Europe, but that's really not how it's going to work. And then on the other side of the coin, people are like, oh, I'm not getting it. I'm not going to be the first person to get it. I'm going to wait a few months. And I think it's going to boil down to these trends in public education campaigns that are probably going to have to be championed by local departments of public health, faith leaders, community leaders, people that are trusted in the community. And that education is so key, because a lot of people don't realize is on the vaccine process and the clinical trial process, the safety doesn't boil down to the time that you spend in the clinical trial process. Just because a vaccine might take 3 years to make compared to 1 year doesn't mean one is safer than the other. It depends on the data, and it depends on the number of participants. So I think people are spooked by how quickly it's happening, but the safety is not directly tied to the time.
It can definitely, I think, make a lot of sense to someone who isn't as integrated into that line of thinking, that the more time it takes to create something, the better it's going to be. But I think that's an excellent point, that, you know, that's not necessarily the case. Does anybody else, any of our other panelists, do you have any things that you're seeing that might arise in 2021, or trends that you're kind of keeping an eye on as we move into the next year?
Yeah, I think something that I've been looking at that isn't maybe tied to delivery of healthcare specifically, but you know, there's been a lot of focus on remote care. But another thing I've been watching is just remote in general, remote work. Seeing, I at least know that I've been working from home since March, and I know at a lot of hospitals there's been more remote work there for particularly for some kind of more administrative back office functions, but also with telehealth, potentially physicians can work and see patients from home as well if they're doing a video visit. And for some of the companies that I follow, healthcare software companies, you know, whether their software engineers might be working from home, and kind of what infrastructure you need to set up to make that possible. So that's definitely kind of another area of healthcare business that I'm wondering how much of that sticks in 2021.
And I know that it changes for a lot of companies by the day in terms of when they might be going back to the office, but that infrastructure is so important. So kind of shifting directions a little bit, I would love to hear from each of you. What excites you most about healthcare, health tech, digital health right now? And Anjali, do you want to kick us off?
Sure. I was trying to think of where I want to go with that, because I think there are multiple things, honestly, but I would say that in general, healthcare has always been one of those challenging beats. It's hard to get people interested in the nitty gritty, and it's fascinating for me. And I think that that is something that still holds. And looking at, you know, the future, and being able to sort of figure out what direction, you know, the entire industry is looking to move into. Will things just return to normal, and can we you know, expect to continue covering on my part, you know, quarterly earnings in the pipeline, or will it be more broadly, you know, is there going to be a greater conversation between the public and the industry, because that started over the drug pricing issue, and so to me, that's one of the most fascinating things is, you know, to the point of more awareness and health coverage, and being able to do more mainstream. How do you convert that? What is the conversion of all of this come the next year, come the next few years? So I'm keeping an eye on that for sure.
Really important, I think, with, you know, consumers getting to understand that process more, and something we'll probably see as, you know, healthcare laws evolve. I know we're seeing a lot kind of happening in the federal and local sense in terms of what does healthcare coverage look like, and that goes to the drug pricing issue. And Megan, would love to hear from, you know, your perspective. What excites you most about health tech, digital health right now?
Answering this question from the perspective of the stories that I find most interesting and surprising to edit, I would have to say it's probably what it looks like to roll out some of these tools into the clinic. I think that tech, and in particular AI, often gets covered in this sort of somewhat binary way, where it's either coverage about the evidence and sort of busting the hype, which I think is very important, or it's sort of glowing, fawning coverage that's like, wow, AI can do everything. And I'm fortunate to work with some really great reporters who have a more nuanced take on some of that. And so some of the most interesting stories I think we've done, and I think there's a lot of ground to cover, look at sort of what it looks like to actually use these tools. And one of my reporters, Erin Broadwin, she had a story last week looking at this program at Duke where they're using anthropologists and social scientists to study how their AI tools are rolled out into the hospital. And so one of the things they found was like, oh, this had this, I think it was a sepsis tool, if I remember right, has made life hugely painful for nurses. And it created this weird power dynamic between nurses who are having to call providers based on this AI tool that they hadn't talked to before. So I think there's a lot of interesting reporting to be done as more of these tools move into actual exam rooms in hospitals. So I think that's the most exciting thing for me to see sort of how that unfolds.
I think what's interesting there is kind of that intersection. You know, healthcare is one of those things that touches every single person. You know, there are some industries out there that don't, and healthcare does. So those intersections of all of these other avenues and industries with healthcare seems to be something that's colliding more and more now than it ever has before, particularly in the public eye. So Alexi, what is exciting you the most about healthcare right now?
There are a lot of things that are exciting despite the fact that we're in pandemic world still, but I think the most exciting thing is just the level of innovation and collaboration that we've seen among the healthcare industry that was really spurred on by the pandemic. It definitely existed before. We have great innovation technologies and breakthroughs in Boston and throughout the country, but I think that COVID-19 really pushed that along a little bit further. I've seen that hospitals and hospital leaders are really just wanting to work together. It's not about the competition anymore. You can see that in the vaccine race. I mean, people have said over and over again, it's not about who wins. We want multiple winners. We are just hoping and praying for multiple winners. It doesn't matter, who it is. So, I mean, and we've seen even innovations that we never thought of before. I wrote a story about Brigham and Women's Hospital. They were running short on PPE for their nurses who were conducting COVID testing. So they created a little testing box, and the nurse stands in the box and puts her hands in these rubber gloves and tests the patient. So you don't even really need PPE. They're kind of in their own bubble and the patient is outside the bubble. And that they created that within a couple of weeks because they were like, we have to do something. So even something as simple as that is really exciting because you have those innovations coming forward to ultimately better the patient experience and the provider experience. And that's just going to continue to ramp up, and the collaboration is going to continue to just propel it forward even more.
That consumerization of healthcare is so evident right now. And I think particularly where you have the public having such a strong eye toward what's going on in the industry, it definitely seems like something that we'll continue to see. Jessica, what about you? What's exciting you the most about, health tech and digital health right now?
I think a really interesting area that a few of us have alluded to throughout this panel is kind of the next stage of virtual care. A lot of hospitals have gotten comfortable with video visits, but also, how do we get devices into patients' homes, whether that's remote monitoring, that, like wearables or fitness trackers that are constantly monitoring patients, or if it's Bluetooth connected stethoscopes to help with a video exam. I think there's a lot of interesting work being done there by hospitals, but then of course, the more virtual we do, it does lead to questions like what Megan mentioned earlier with, not everyone has great access to internet. Not everyone has a laptop or a desktop computer with high quality video. Not everyone has access to devices that can do high quality remote monitoring. So how are hospitals and health insurers going to be accounting for that and making sure that these new programs, these emerging programs are accessible to all of the populations that they need to be treating?
Definitely such an important topic. We talk about access to healthcare all the time, and just because we're taking it virtual doesn't mean that those access issues are 100% resolved, and something we'll have to look to, the policymakers, the business leaders in our communities to really help solve that issue to make sure that it's, equitable.
Great. So I have a few questions of my own. And my first question is actually a follow-up to the first answer. As you said, Anjali, this is in a way your Super Bowl. You've all been covering the pandemic since the very beginning, and this has just been such an emotional story for the whole country. And obviously you've been, Alexi, talking about interviewing nurses on the ground. I know there have been so many powerful stories, life and death. How are each of you, I want to hear from everyone, how are you kind of coping with this? How do you establish work-life balance, and how do you, you're facing this wall of news every day that's super intense. I just wanted to hear about how you all deal with that.
Okay, I can go first. I would say that I take the risk of actually turning off notifications on my phone every so often. I pick like a day where I feel like, okay, there was a really big news rush. Chances are, it's almost gaming the system. Chances are there's not going to be anything too earth-shattering today. I can mentally sort of stay calm rather than on full alert. And so it's not as often as I would like. I wish I had, full weekends to be able to do that. But that's not happening anymore. And so it's just a random day in the week where I just sort of, relax, kick back, try to absorb other news, other sectors of how, COVID is hitting. And that also actually helps my own reporting as well, to kind of stay cognizant of that. But that's really it. And then in the time that I do have breaks, definitely getting out, masked, of course, and socially distant, but going for quick walks in the nearby park. That's the best way that I can relieve, any stress, even though it is getting colder. So that's not as possible anymore, or I don't want to, but that's how I'm handling it right now.
I would agree with Anjali. It's such a hard balance. I mean, we're reporting on the pandemic, but we're also living it. So, I mean, everybody has the daily stresses of living during this pandemic, being fearful that you might get sick or fearful that someone else might get sick. And I also feel like the mental toll of just going about daily activities can be difficult. Like, I have to go to the store. Is there hand sanitizer in my car? Do I have my mask with me? Can I bring my reusable bags? Are they not doing that anymore? Like, it's a constant swirl. So it's been tough living the pandemic, reporting on the pandemic. I lost my grandmother to COVID-19, which was really difficult. So I would agree with Anjali that getting out has been like so therapeutic, especially when the weather's nice. Spending time outside is just the best. Listening to podcasts, that's my thing. I go for a walk, listen to my podcasts. And that's been really good. And then just trying to connect with friends and family in any way that you can. Maybe you're like living with your family so you can actually hang out with them, or just meeting up with friends outside is totally fine. And those things have been just excellent.
Yeah, I think work-life balance has definitely been challenged during this time, first of all, because there's just so much healthcare news happening. And then also, I don't know about anyone else, but for me, back when I was working at the office, if there was a day where I had, had a busy day at work, was pretty sure nothing was going to happen in the evening, I would leave my work laptop at the office and then come home. But right now, since I'm working from home, my work laptop's always here. It can be very tempting for me, at least, to just kind of sign on, want to check what's happening, and understanding that sometimes, it's good to be the most up to date, but sometimes that's not the healthiest to do. And in part because of the pandemic, I went through and canceled a lot of trips that I had this year, and kind of had to remind myself that even if travel isn't happening as much, it's still important to take time off, even if those days are just spent. I live in Chicago, so just spending those days in Chicago, but, taking a walk or going to the park for most of the day, and, understanding, as people like to say, it's a marathon, not a sprint. So need to be sure to check in with yourself every now and again.
I don't know if I have any wise advice that other people haven't already offered. I mean, I, like everybody else, I'm trying to go outside for walks and take time away from my computer. I am very mindful of the time that I spend outside of work and try really hard not to look at Twitter. It helps that I don't like looking at Twitter. And I think I'm probably more fortunate in some ways in that some of the coverage that I edit and am on call for more often doesn't have news that breaks as often outside of work hours, as opposed to some of the other editors. But I think, I'm grateful to Stat for having a good system set up for kind of everybody's looking out for each other. Everybody knows that like we all have stressors and things going on outside of work right now, and that's just hard. So I feel like there's the benefit of having a number of editors and a number of reporters who are all focused on health is that like we can divide and conquer a little bit easier sometimes. Like we have a weekend rotation, which is helpful. So not everyone has to be like scanning the internet all weekend or like watching press conferences on the weekends and stuff. So I don't have any easy answers. It's hard. It's just really hard.
So Alexia, I'm really sorry to hear about your grandmother. And yeah, thank you for those thoughtful answers. Okay, my next two questions are, I think you'll all have a lot of opinions. The first thing, and I think this is relevant for a lot of people in our audience, you get 1 million pitches a day, especially in the beginning of the pandemic. I know there was a lot of talk, and I'm sure there still is, about the tone deaf pitches. There's a million examples. What advice would you tell to PR folks such as ourselves about what we should be telling our healthcare clients in terms of press releases, frequency, types of news that's going out? I see Angela smiling because clearly some people might be making mistakes, not our clients. But yeah, I would love to hear from all of you your wise words on that.
Yeah, I can definitely go on that. How do I say this nicely? No, I'm kidding. So I would say that there are still some tone deaf pitches. There are people who are taking advantage, as is kind of expected, but I just wish I didn't have to deal with it, of the pandemic, saying, oh, this company is doing XYZ and it's because of the pandemic that they're working from home. Well, hi, so is everyone else. And there's only so much advice that you can give that isn't already out there. People are still figuring it out. So I understand the need to get your clients airtime or, visibility, but I would say that you also have to understand that we're in the position of looking tone deaf ourselves if we try to cover anything outside of what is absolutely critical right now, knowing what is going on in the news industry, knowing that resources, even if they are there, are still limited no matter who you look at across the board. Every news outlet is trying to figure out how to handle a balance of some sort. So my best advice is please don't pitch. And I know that's like the worst thing to say, but really, I wish I could say that in every email when I respond, but instead I'm like, sorry, no capacity right now. That's my hint of I'm not touching this right now.
That's very polite. Thank you. Okay, everyone else.
Really the main advice that I like to give, and I don't know if every reporter would agree with me, but for me, I would definitely say if a PR person or someone who's pitching isn't super familiar with modern healthcare or what I do in particular, don't hesitate to email me and kind of ask what I cover and ask what I'm looking for, because I know I worked at a different healthcare publication before I worked at Modern Healthcare, and there were differences in the types of pitches that we would accept. For example, I've worked at places that kind of emphasize timeliness, so they would publish things about new products, but not necessarily long-term case studies, whereas at Modern Healthcare, we really don't cover product launches. So anytime I get a pitch about a new product, it's pretty much an immediate, we don't cover this. Whereas, if you have a case study of a product that launched a few years ago in a hospital that's had some particular outcomes with it, maybe that is something that we could look into a bit more and see if it's something our readers would be interested in. So just kind of, asking what we're interested in. And then, when I give a response, remembering that there are some pitches that just aren't going to be a fit for us.
Yeah, I would echo what Jessica said, which is like, I'm always happy to, I say this and then I don't want to get like 60 emails that ask me this, but like, I'm always happy to give, like I've done that many times, honestly. Like I'm always happy to jump on the phone with someone for 10 minutes and say like, this is what we're interested in and this is what we're not interested in. I know not everyone has the luxury of that time, and I certainly have less of that time now, but like if you have 5 questions and you want to know, like, do we cover fundraising rounds? Do we cover new product launches? Like, I can rattle off those answers for you very quickly if that is helpful. To me, like, I honestly delete a lot of pitches. Like, I just can't look at my inbox every morning. There's like hundreds of emails in there every morning. And I think like doing that is helpful probably on your end and also on my end, because it gives me a better understanding of what you are going to be pitching, and I will be probably more mindful of not deleting those pitches right away. Just like having some sort of familiarity, even of someone's name and sort of the companies that they work with and stuff. But I would also echo what Anjali said, which is that, like, honestly, we don't take a lot of pitches. We don't write off a lot of pitches. So the ones that I think catch my eye the most, and is probably true of other people at Stat, are like when someone has really taken the time to understand what like a Stat story would look like and been thoughtful about that. And it's not just like, my company exists, or, you know, this product exists, and really, you know, thinking about what they're pitching and how it fits into the broader space that we cover.
I would echo what everybody else said. The only thing that I'll add is, for myself in particular, and this may not apply to everybody, I'm looking for local stories. So a lot of people will be like, oh, interview my client. They're an expert on like vaccinology and they're in LA. And I'm like, oh, okay, no. So if it's not in the greater Boston area or even like in Massachusetts itself, it's probably not something that I'm going to take the time for. So the locality is really important for me in particular. And I do get a lot of pitches that are just from here, there, and everywhere. So it's kind of frustrating.
Yeah, I remember that. Okay. So I know Rachel has one question, and then after that, we can get to a couple of the questions in the chat, and thanks for everyone in the audience for throwing in a few of those questions.
So I was glad to hear that none of those bad pitch stories were ones that I sent. So just wiping a little sweat off my brow there, is a little worried. But I kind of want to take this in a little bit of a different direction. So another big storyline that we've seen, since March is really that focus on racial equity and diversity. And I think a lot of companies right now and the business press really is looking very hard at what is diversity and inclusion, are these, initiatives moving forward, things like that. So I'd love to hear from you, what types of diversity issues are key for the healthcare industry? Both to monitor and consider, and from a news sense, what are you thinking about? And Anjali, it would be great if maybe start.
Yeah, thanks for the question, because this is actually something that I have been monitoring. And I think that largely in my years covering the industry, there has been a discussion sort of brewing. It has never come to the mainstream about the health disparities. And so you've seen sort of one-off pockets, and I've covered this as well. You've seen pockets of action. So you've seen, say, a hospital take on the role of inspecting an elderly person's home, installing bars in the shower, or setting up food banks, or like community food gardens even. All these things that both insurers and providers have been doing. You've also seen some pharma companies sort of step in with price caps on certain, high profile products. So catering to obviously different socioeconomic groups. And so I think that that's something that continues to be a discussion and has not been discussed well. And so that's something that I continue to monitor, because as much as data comes out, it's also very piecemeal. As much as programs come out, it's all very piecemeal. And so that's the conversation I think the healthcare industry is waiting to have more in depth once they can gain the time to do so. But it should be something that they're talking about now. And I've definitely been having conversations about that, where there just isn't enough data to support any one action or the other, because they've still been sort of in experimental mode. And so I'm really intrigued by all of this and the attention it's getting. I think I've heard more about the tribal nations and the Indian Health Services this year than I have ever in the past. I think people actually know it exists now in a way that they didn't before. So very interesting to watch, and I have my eyes really in that direction.
Anybody else?
Anybody else?
Yeah, oops, sorry. Okay, just so we can take a couple of audience questions since we obviously have a hard stop at 1. There's a few questions in here. I think I would be interested to hear from people about the story of mental health during the pandemic, obviously, and how much you're covering it, because clearly, you know, there's going to be a lot of depression among probably everybody, but especially children. And I just think there's a huge story there. I was just reading a story yesterday, I think in CNBC, about the pandemic of grief that's going to kind of come, is probably here now and is going to be with us after the pandemic. So would love to hear about that.
I've definitely done a bit of reporting on the mental health crisis that's facing us and will continue to ramp up. I mean, we're in the pandemic right now, and I think it's going to be a pandemic of mental health crises with grief, anxiety, depression. I did a story not too long ago, and some experts had said that they are seeing patients develop anxiety and depression who had never even previously had issues with their mental health. So these issues are cropping up for folks who may not have even experienced them before, and therefore they might be less equipped to get help for themselves. So that's a big issue that'll probably make a lasting impact. I mean, I talked to one psychologist that said what Americans are experiencing now will cause more and is causing more mental distress than 9/11. So that was really just gripping for me to hear. It's gonna take, I think, a lot of reliance on our healthcare system to try to remedy these issues. Some of that can be telemedicine, because people can get better, quicker access to a therapist, especially if they may not have ever seen a therapist before. They may feel more comfortable doing it at home, doing it over a telemedicine or what have you. It's definitely something we need to pay attention to, and I think there's a lot of really good local efforts that are going on. I know I did a couple stories with Whittier Street Health Center here in Boston, and they are tailoring some of their therapy group sessions to those who have been disproportionately impacted by the pandemic, whether it be low-income communities, communities of color, or people, you know, who are at high risk or essential workers. So it's something that needs a lot of attention. I don't think it has enough right now, and I think it will unfortunately get worse. And people may not realize it right now. They may be, like when I was interviewing nurses during the peak, they were like, we don't feel mental distress. We're just going to work every day. We're getting through it. Our minds are occupied. And I think that's going to set in for people later on.
Yeah. Great.
I couldn't agree more. That's pretty much across the board. You're absolutely right, Alexi, in terms of not just who it's going to be affecting, but also to what degree. And excellent point on the fact that right now everyone's preoccupied, and even for the ones who aren't, I think that that's also an important point to make. Also, you know, one of the things I've also seen and I'm concerned about is those who are unemployed right now. We are lucky, everyone on this panel, to continue to be employed and be able to work from home. And for those who are currently suffering and unable to and have no path forward, those are probably going to be the ones we hear about pretty shortly.
Great. I also wanted to get to our very first question, and this might have to be our last question, depending on how many people want to talk about it, but just it's something I read about and I'm sure you all wrote about in the very beginning, and I think it's ongoing, where we all, or most of us, kind of stayed in as best we could for 6 months plus, you know, maybe ignoring certain aches and pains, not getting mammograms or colonoscopies. And so sort of the you know, all the health issues that will arise from that. How much are you focused on that or not focused on that aspect of healthcare?
I would say that not much has changed in terms of just that being the point, but also when you're looking at for the future, I think you can see some activity has picked back up. So that is still, I think, in the middle. I think my sense of it is that it's still a problem. Some activity has returned to normal, but you're going to still continue to see this sort of drain on that part of health service.
Yeah, I would just add one thing that we have been watching as things have shifted back to normal a little bit more and telemedicine visits are dropping back down is thinking or looking carefully, I guess I should say, at what types of telemedicine will stick and for which conditions, and which conditions people are headed back into the doctor's office for. So that's certainly something that I don't think we have clear data on it yet, but I think it's something that we will see more details on pretty soon.
Great. Well, we're just about time, and I want to be respectful of everyone watching and our panelists. So really thank you so much to Anjali, Alexi, Jessica, and Megan for joining us today. And, you know, we have been recording this panel, so we'll be sure to put that up on the IncHouse blog, so you can see that if you want to rewatch it. Really, I think we had a great conversation, touched on a lot of important things, and be sure to check out these wonderful reporters reporting. And thank you so much, and have a great day.